For those of you that don't know me, my name's Aidy Maguire. I am a researcher and lecturer in the Centre for Public Health at Queen's University in Belfast and director of the Administrative Data Research Centre Northern Ireland. And we'll talk a little bit about that in a moment. But I just want to welcome you all today to this wonderful symposium on care experienced children and young people. We have a wealth of research going on within ADR UK on this so often underserved group in research of care experienced children and young people. Often individuals with care experience are difficult to include in standard research. Survey-based research, it can be difficult to identify these individuals, but projects using administrative data lend themselves well to better understanding the predictors and outcomes related to experiences of social care in childhood. So administrative data can't tell us the whole story. It outlines the picture, and the colour is added by including the voices of those people who have lived these experiences. We've got 5 wonderful speakers today, each of which could have taken up a whole hour and a half session themselves. They all work in some way with ADR UK. So for those of you that are unaware of ADR UK, Administrative Data Research UK is a consortium of research units across England, Scotland, Wales and Northern Ireland, whose mission is to make available administrative data for research purposes. And administrative data is data that's collected or collated for the delivery of a service, such as school, healthcare. It's not primarily collected for research, but it contains a wealth of information about our population. We have a few links here to our main website, annual reports, and how to sign up to our newsletter. We'll share the slides again at the end and put these slides up again at the end if you want to scan the QR codes to find a way to learn more about ADR UK. A little bit of basic housekeeping for the meeting today. Please mute your microphone. There will be set times for questions. Please leave your questions in the chat maybe, and there's a Q&A box, but you can just put them into the chat, or feel free whenever we ask is there any questions to raise your hand. I've asked you to turn off your camera, but if you want to leave your camera on, that would be nice. It's difficult sometimes for our presenters to just look at a blank screen, but for the Q&A session or even discussions at the end, if you could turn your camera on, if you feel comfortable with that, that would be fantastic. Today's event will be recorded and available on the ADR UK YouTube channel. So in our agenda, we've got 5 speakers. You'll get information about them and their bios on the event website, so I'll not go into too much detail. We'll just crack straight on and start with Professor Karen Broadhurst from Lancaster University, who leads up the ADR England Research Community Catalyst funded project exploring children at risk of poor outcomes. So welcome, Karen.
Hi, Aidy. Great to be here.
I'm going to stop sharing the screen because for now I think it's just you and I in discussion for about 10 minutes.
Okay.
First of all, can you tell us about your Children at Risk of Poor Outcomes Community Catalyst funded project? What's the project about? What's your aims?
Sure. Okay. Thanks, Aidy. So this is a project that I'm co-leading with Lucy Griffiths, who I think is in the audience today. It's funded by ADR England and the Foundation's What Works Centre for Children's Social Care. Now, the overarching aim of the Catalyst Aiding is to boost the use of ADR England and indeed ADR UK flagship data sets to try and better understand what's happening for children who are involved with children's social care. So we're talking about children who are at risk of poor outcomes, but broadly conceived, these children will have some children's social care involvement. And to date, I think we've made fantastic progress with education data sets, health data sets, but actually children's social care has rather been lagging behind. And if we think about social workers support on average 4 or 5 children in every classroom in England, it's an area that's pretty much overlooked. So the Catalyst got 4 objectives. One is to provide leadership around research priorities. So where are the gaps? Where is there a kind of real gaping hole in evidence? Where are the strengths of evidence? Capacity building and community building, which are linked, and also to begin to address research priorities. So we have a fellow based at UCL also running alongside this project and already beginning to make some inroads around child in need. So the view of the Catalyst team, our starting point fundamentally is that where we connect researchers, where they can form community, share, learn from each other. That can shortcut work, it can make getting going a lot easier, it can give confidence to ECRs. So I think we're a very collaborative group of leads, including colleagues at UCL, Sussex and Imperial. Yeah, so that's it, hopefully in a nutshell, Nadine.
That's a very brief overview of a fantastic amount of work that's going on. You mentioned very briefly their flagship data sets. Do you want to say what you mean by that, or for anyone that doesn't know, or would you like me to say what we mean by that?
Yeah, you can do that. I mean, if I think that we've got Emma here putting links in the chat as well.
Oh, perfect.
But I mean, I think the point that I'd like to make about what ADR UK has been doing is really unlocking the wealth of data that Aideen was talking about, but also making that data linkable. So if you think about the MOJ DFE data share that I think Katie Hunter today is speaking to, what policymakers and practitioners really want to know is they want to know what's happening for this child, what's happening for this family across services. So it's a remarkable achievement for ADR UK to actually be able to begin to see across services. So there's a list of those data sets. I'm not going to list them now, but obviously the Data First have made great progress as well in the criminal justice space, just a big shout out for Data First. But we've got now the eChild data set and the DFE MOJ data share, which are absolutely ripe for use by the children's social care research community.
Excellent. Thanks so much, Karen. You mentioned briefly there about stakeholders. You're working very closely in this project with some non-academic stakeholders. What value do you think they can add?
So academic stakeholders are hugely valuable to us right through the project. So from start to end, they are integral to what we're doing. And we've got a really great steering group. So we've got access to advice throughout, but we did at the start of the project, we led by doing a large stakeholder consultation because we felt like we need to kind of like really be up to speed with what stakeholders think are the current priorities, what's happening for children, and what do stakeholders want to know more about. I mean, what was really interesting from that consultation, which was led by Catherine Tranter, who's also on the call. Catherine's an experienced social worker, so it was quite good to have her doing the consultation, as she recently left senior mental health social work with children and families, so it was kind of bang on stakeholder agenda. But I think Lucy's going to put a link to our agenda in the chat, but we wanted to develop a research agenda that was informed by research evidence, you know, the state of research evidence, but also we wanted it to be bang up to date in what stakeholder priorities were. Really consistent across stakeholders was family hardship, poverty, and the impact on that, on what children's social care services can do in the lives of families. But also, I think it was that consultation was a clear endorsement of the position and overarching aim of ADR UK, which is stakeholders said to us very clearly, we need to get out of our silos. If I have a child that's involved that's having difficulties at school, are they also involved with health services? Are they involved with the criminal justice system? So yeah, it was loads of enthusiasm from stakeholders and some really clear steers around research priorities. And those are in the research agenda, which hopefully Lucy's popping into the chat.
Yes, perfect. So we don't want to cover all of the work, I suppose, that you've done, or again, we could be here for the full hour, but are there any sort of key achievements or progress that's been made that you want to highlight?
I think that the research review that was led by Grace Bailey at Swansea is really comprehensive. It's a huge piece of work. It's a synthesis of the quant evidence, including admin data, including flagship data, but also other admin data sets, local authority data sets. I think that really was illuminating in helping us to think about where the gaps are. So there's a huge amount of work. Well, there's a good deal of work done on children in care. And obviously we don't want to stop that. We want to see more of that. But there's really quite major gaps in the early intervention space. Now, this is a space that's quite hard to capture, but seeing the kind of data studies in the prevention space, I think was really illuminating and gave a really clear signal. So DFE, you know, they've noted that, foundations have noted that, and given that we're now in the sort of implementation stage of our wholesale review of children's social care in England, with a new practice framework that firmly endorses prevention, it's vital that the ADR UK community get behind that agenda too, and use what we have, but also push for further development of the flagship data sets.
Absolutely, and if you can, inform that agenda with information about your own population, that's fantastic.
Yeah. The other thing to say, Aideen, just because time's marching on a bit, is we're also running a programme of really accessible events. So just want to give a bit of a shout out for those events. So we've been trying to run events online as accessible as possible, as short as possible, an hour and a half. A fantastic uptake of those events, but we have one on the 23rd, which is actually on early intervention. So that's the 23rd of June. It's open to everybody. Marie Greaves is the administrator at Project Officer at Swansea, who you can write to. Lucy's probably putting links in the chat as I'm speaking. We also have a cross-justice event in July, which we're just confirming now. And we also have a workshop for early career researchers at the ADR UK conference in September. So we've already run a workshop, interactive workshop, and how to get money, because this is fundamental to people accessing data. But those events, look out for all of those. And if you're stuck, if you can't access them, do write to either myself or Lucy or to Marie, and we can help you access. But the next one is next week, 23rd of June in the morning, 9:30. So it'd be great to see you there.
Excellent plug, but also a raft of excellent events and resources coming up for researchers of particular interest probably to everybody on this call. I was going to ask you how can researchers with an interest in the topic area get in touch, but you've just listed these all off, and I suppose Emma has popped a few links in the chat there, so folks really should try and reach out to join Karen's network. Another thing that we haven't touched on that I think is super important that I'm not going to say much about, but Karen, if you could say something about, is the report that was published recently in collaboration with NatSen.
Yeah, so NatSen and ADR UK jointly published a report very recently. It's a great report, and it showcases what can be done, the excellent research that can be done across the UK with administrative data. And we've actually got the 4 speakers today featured in the report. So we've got Sarah, Katie, Joanna and Laurie. I know you're going to introduce them, Aideen. But I think what they do is show the value of admin data to understand children's journeys through services, to highlight inequities, to highlight trends over time, to highlight some really concerning outcomes. Obviously, admin data is only one source of data. As you said at the start, Aideen, it gives us a high-level picture, gives us that population scale picture, but we do need that picture in order to kind of get a representative view of what's happening to children's services. So again, I think Emma's also putting that link, but I'd encourage people to read that. It's a very accessible report, and it links through to the full papers too.
That's excellent. Thank you so much, Karen. And thank you so much for keeping to time. Like I say, we could talk for another full hour about all the work that's going on, but I want to encourage everybody on the call today to check out the links in the chat there to the project pages for children at risk of poor outcomes, and definitely at the next ADR UK conference to sign up for that workshop. Thank you so much, Karen.
Thank you, Aideen.
Great. We're going to move on now to hear from some of that work that Karen highlighted that's been published in this NatSen report. And we're going to hear about ongoing work across the 4 ADR UK investments, starting with Dr. Sarah McKenna from Queen's University Belfast and ADRCNI. So there's a Northern Ireland perspective. Sarah, do you want to share your screen?
Yes, certainly. Hi, everyone. Hi, Aideen. Thank you. Just give me a moment to get my slides.
Sure. I'm not going to go over introductions and bios of each of the presenters. Like I say, you can introduce yourselves, and there's a wealth of information on the website about everyone's backgrounds. We'll hand over to you now, Sarah. Thanks.
Sure. Thanks. Well, hello, everybody. I'm Sarah, and I'm from ADR Northern Ireland, although this is a Yorkshire accent, so you'll have a bit more chance of understanding what I'm saying. And I'm part of a team at ADR Northern Ireland, and we're interested in life after care. So specifically, we're researching the adult outcomes of care experienced children and young people. So why is this important, and what can administrative data tell us about adult outcomes? Well, I think it's worth reminding ourselves to start with about the aim of the care system. So the aim of the care system is to protect and support children who are at risk, ensuring that they grow up safe, healthy and with the best possible opportunities. So the aspiration for children is that they thrive as adults, not just survive and get by. So how do we know then if this aim is being achieved? Well, as a minimum, we need robust longitudinal data that tells us about a whole host of outcomes, employment, education, physical health, mental health, mortality, housing, the list goes on. But interestingly, when we were at the beginning of this programme of research and we met with our project partners at the Department of Health, they told us that the right sort of data simply doesn't exist. And really what they were getting at is that there is minimal data collection, statutory data collection about care leavers. So these are young people that age out of the care system. It's across a limited number of measures, it's for a limited period of time, and it excludes that wider cohort of children who spent time in care but didn't age out of the system. So what that means is that the lives and needs of care experienced children when they're adults is hidden. We're in the dark. So enter centre stage administrative data. And I'll be preaching to the converted to those of you on the call that work in this field already. But what population level, what administrative data lens is that population-wide coverage? As Aidan mentioned earlier, we can look at rare exposures like care experience. We can look at rare outcomes like, for example, suicide. And if we can harness that data that's siloed across different systems, then we can start to build a more complete view of children who've spent time in care from early life right through into adulthood. And then the idea is that we not only can look at whole populations of care experienced adults, we can also look within that population and see if there are any particular risk or protective factors, and then ideally that helps prevention efforts and the targeting of support to where it's needed most. So this next slide then just shares some of the administrative data that we have available to us in Northern Ireland. Now, for context, Northern Ireland has an integrated health and social care system. We have something a bit different to the local authority structure responsible for social care that exists in other UK jurisdictions. So we have 5 health and social care trusts. They all collect data about children's social care activity, and it's all collated centrally and available to researchers. So previously we have linked children's social care data to death records, and that's the study that I'll go into a bit more detail about shortly. We've also linked to something called the Northern Ireland Registry of Self-Harm, and it's a nationwide surveillance system. Essentially, it records all presentations to accident and emergency departments across all Northern Ireland hospitals if somebody presents with an act of self-harm or with thoughts of self-harm or suicide. And we've published work around that shows really quite stark rates of self-harm and suicide ideation among care experienced adults. Our good colleagues Lisa Bunting, who also contributed to the NatSen report, and Nicole Gleghorn have done a lot of work linking social care data to deprivation measures, showing the link between poverty and rates of entry to care. Myself and colleagues are currently using statutory homelessness data in Northern Ireland. Those results are due probably later this year, but I can already tell you that we're seeing quite startling rates of homelessness amongst care experienced young adults. And then we've a raft of other projects at various stages of approval or waiting for data, and the data sets we'll be accessing include prescribing data, hospital data, census, prison health, the child health system and maternal health system data. So I'm sure you can see from that slide that there's enormous scope for exploring a whole host of outcomes for children and young people with experience of care. And I just want to share my favourite slide. So I need to mention, I haven't got time to go into it in detail, but we're working really closely with the charity VOIPIC, which stands for Voice of Young People in Care, and a group of care experienced young people throughout our research. And what we're trying to do is take a co-production approach. So there's been loads of activity over the last 3 years. I'm not going to read through all of the numbers on that slide, but a special mention to the 4 young people in the photograph there, from left to right. That is Isla, Ash, Rihanna and Martha. And amongst the many things they've contributed, they've recently co-authored a paper with the team, really trying to share that process of involving care experienced young people in administrative data research. So big up to those guys. Moving on to a more sobering topic, a study about care experience and mortality risk in adulthood. So in this particular piece of analysis, we linked a GP registration data. Almost 100% of the population in Northern Ireland is registered with a GP, so we tend to use that health registration data to give us our population spine of Northern Ireland. And then we link to children's social care data, obviously, and to death records. Now, we did also look at different levels of social care involvement below the threshold of care, but I'm going to focus these results just on care experience, given the topic of this particular symposium. And we were interested in what we call sudden deaths, and that is a grouping of deaths that includes assaults, accidents and suicide. And we also looked at suicide as an individual outcome as well. So we identified from these data sets a birth cohort in Northern Ireland born between 1985 and 1997. That gave us over 430,000 young adults who were alive and resident in Northern Ireland during the follow-up period. Of that cohort, just under 6,000 or 1.3% of the adults in the study had experience of care as a child. And in terms of the methods, we use survival analysis techniques. So survival analysis, for those of you that don't know, is a suite of techniques where you're looking at time to an event of interest. And you can model the data to give you something called a hazard ratio, which really quantifies the risk in a particular group, in this case care experience, compared to a group, to another group. And in this study, it was young adults that had no record of ever being in contact with social services as a child. So we followed each individual in the cohort from their 18th birthday, and they were followed up to a maximum age of 36. The death data ended in 2021, and individuals either died, or some emigrated, or some then just reached the end of the observation period. And over the follow-up period, we observed over 1,200 sudden deaths, and there were 746 deaths by suicide. Now, suicide is thankfully a rare outcome in the population, but what we saw from this study is that it's disproportionately happens amongst care experienced young adults. So if you remember, I said they were at 1.3% of our study cohort, but they accounted for 9%, or 1 in 11 deaths by suicide were in care experienced young adults. And then when we modelled the data to take into account other known risk factors, what we found was care experienced adults had 5 times the risk of all-cause mortality, 7 times the risk of sudden death, and 8 times the risk of death by suicide, compared to young adults of a similar age that had never been in contact with children's social care. So some quite hard-hitting statistics there. This work and the other work I've mentioned by my colleagues Lisa Bunting and Nicole has informed the current strategy for care experienced children and young people in Northern Ireland, and it's also included in the report that came out of the recent independent review of children's social care, which reported in 2020. My computer's doing some sort of an update there. I don't know if you can see that on the screen, just got rid of it. this report was issued in 2023 and is currently going through all the outworkings of implementation and exploring how to address the many recommendations included in that report. So back then to where we started by saying that the right sort of data simply doesn't exist. We would say emphatically that the right sort of data does exist. And if we can harness the power of administrative data, then we can shine a light on the adult lives and experiences of children and young people that have spent time in care. And if I could just finally end by thanking the many people involved in this work, Voice of Young People in Care and the young people, the staff of the Honest Broker Service who provide us with access to the data, to my colleagues and co-authors, Aileen Maguire, Dermot O'Reilly, Lisa and Nicole, and particularly to Dermot, who sadly is no longer with us, but is probably the driving force between securing access to all of those listed data sets that I mentioned on an earlier slide. So the biggest thanks to Dermot, and thanks to you all for listening.
Thank you so much, Sarah, and I see a bunch of reactions from the audience coming in there. Beautiful presentation. We do have about 2 minutes for questions. Like I mentioned, there'll be time for questions at the end, but does anybody have a question now? You can put it in the chat or raise your hand, just unmute yourself. Fascinating work, Sarah. I'll have a question while we wait and see if anyone puts anything in the chat. I know I'm involved in this research, but I suppose I've looked at results overall and not maybe in detail in the care experience children themselves, as opposed to looking at children known to social services more broadly. But were you able to look at any aspects of the care experience in terms of was the child in residential care, foster care, kinship care, etc.?
Yeah, we did do some of that kind of analysis. Now, the challenge for the mortality work was around small numbers. So we didn't actually publish that work, but we did see that age at entry to care made a difference. But it is an approach that we're taking across other adult outcome studies. So I'm doing a piece of work at the moment that is looking in particular at aspects of a young person's time during care, things like what age did they enter care, how long were they in care, what sort of placement type were they in primarily, what was their final placement type, where was the child discharged to, where did the young person go when they left care. And we're looking at all of those as factors in subsequent risk of homelessness. And we've done similar analysis with mental health as well, where we've looked at care experiences and things that happen while a child is in care to see if there are any points or characteristics that can help us see where interventions may be directed.
Excellent. And I suppose it is difficult because each person's care experience is so different, and it's so complex. I see Eve has put in the chat, is there a link to the co-authored paper with young people? So can we pop that in the chat?
Most certainly. Yeah. Oh, actually, no, sorry, I beg your pardon. The academic paper is under review currently, so it's not yet published. We have a raft of easy read publications that the young people produced about some of our other studies. I can share links to them, but I'll just say watch our Twitter and watch ADR UK Twitter for the academic paper publication co-authored, because it's not out just yet.
Yeah, but I suppose the link to the other resources would be fantastic. We have time for one quick question. I see 2 hands are raised, but Gillian was in first, I think, if you want to ask a quick question before we move on.
Yes, very quickly, very interesting presentation. Was the risk higher in children who came into care as very young, or the other cohort who came into care around 14, 15, that age? Which way did it go?
Younger age entry was protective, Gillian, so it was the later entrants that had the higher risk. Yeah,
that's interesting. That because they're very different cohorts and very different backgrounds.
Yes. Indeed.
Yeah. That tells a different story, I think, from if it had been the earlier ones. Thank you.
Yeah, I think that's fascinating for people not in the field. Maybe that might surprise them, actually, that it is the later entrants that have the higher risk. We have another question, but maybe Eliza can wait till later, and when we have a little bit of time at the end. We're going to move straight on now, just in the interest of timekeeping, to Joanna. So thank you very much, Sarah. We now have Joanna from the University of Strathclyde and ADR Scotland, who's going to present some of the work that they've been doing. And there we will ask Joanna to share her slides. Oh, perfect.
Lovely.
Oh,
thank you, Aidan. Can you see that okay?
Thank you. We can see it. I'll hand over to you. Thank you.
Perfect. Thank you. Hi, everyone. Thanks for coming along and having me. I'm going to present today on a piece of work carried out with my colleague, Dr. Robert Porter. We're based in Celsius at Strathclyde University, as Aidan said. And it's a project called Growing Up in Kinship Care. So as you can probably tell from the name, this project isn't kind of focused on children with care experience in general, but a particular group of children and young people within that. And that's children and young people who have spent time living in kinship care. So just to be clear for anyone who's unaware, what I mean by kinship care, particularly in terms of this research, it's a situation where a child or young person would come into the care of their local authority, but rather than going to live in residential care or with foster carers, they would live with a member of their extended family or a family friend. The key thing is it's someone that's known to them prior to them coming into care. And the reason why we're interested in looking at this particular group of people is that in the last 10 to 15 years or so in Scotland, there's been a national policy position and a policy preference that when a child does come into care, that should be the first option explored for that child or young person. And coinciding with that kind of policy position, what we have seen is that there's been a shift in practice as well, and that the proportion of children in care who are living with kinship carers has risen quite considerably over the last short while. So looking at the period we explored for our study, which was 2008 to 2019 that we had data for, we saw that rise from around 1 in 6 children in care living with kinship carers to more than a third. So really quite a substantial change there. However, in spite of this kind of policy position that we have and this substantial change in practice, there hasn't actually been a great deal of research, certainly within Scotland, to understand, well, how well is this arrangement working for children and young people, and what outcomes are we seeing for these children and young people? So that was kind of the driver for this study. We wanted to use what available administrative data there was out there to try and get a better sense of the experiences for children and young people in kinship care. So our study, as I say, we had data that covered the time period from 2008 to 2019 largely, and we had information on any child who had spent time living in kinship care and well looked after by their local authority over that time period in Scotland, and that accounted to around 19,000 children and young people. So our key data set for this was the looked after children statistics. So that's the information from local authority social work services on when children come into care, how long they're there, how many places they live in, and so on. However, we're interested to go beyond that and understand not just their experiences of care, but their wider lives as well. So we were able to link that to a variety of different data sources. And that's including data from education on attainment, attendance, and so on and so forth. Data from the children's hearing system and the child protection system, and also data, some health data, and that was largely focused around early childhood development and health visiting data. And so by bringing all of this information together, what we were aiming to achieve was to get an increased understanding of kinship care usage within Scotland, how that potentially varies across time and across different areas of the country, what children's pathways into and out of kinship care were like, and also how children in kinship care were faring in terms of their wider outcomes and wider life experiences. So that was what we hoped to achieve with this project. So one of the first things we looked at was what the kind of geographical variation was within kinship care in Scotland. So the graph here is showing for each local authority area within Scotland, what percentage of the children who are in care were living with kinship carers. And so what you can see from this graph is that it varies quite substantially across the different regions of Scotland. And so that can be from over 50% in Glasgow and Stirling to lower, around 1 in 5 in Edinburgh and Dundee. So even just looking across some of the larger, more kind of urban centres in Scotland where you might expect to see some similarities, there's real evidence of a difference there. We did do some exploratory work to look at a variety of different factors to see what might be influencing that and driving this kind of big variation that we were seeing. And that's kind of looking at things such as local authority level factors and the demographics of the care population. And the only thing that we found that was related to that variation was the local area level deprivation, with some moderate evidence that higher levels of deprivation were linked to more children living in kinship care within an area. But certainly a lot more to unpick and understand about this variation, given that national position that we have towards kinship care. So as I said earlier, we have a position where when a child or young person does come into care, that kinship care should be explored as the first option for that child where there is a viable option to do so. And by having this kind of administrative data that's at the child level and longitudinal, we can look at children's journeys over time and see whether or not that's in fact being implemented for children. And what we found was that for the 19,000 children in our cohort, that 2/3 of those children did move directly into kinship care at the point that they were looked after by the local authority. Of the remaining 30 who didn't, we saw that actually more than half of those children were recorded as being looked after at home before they came into kinship care. And that's a scenario that's more common in Scotland than in many of the other UK nations, where a reasonable proportion of children, young people who are in local authority care actually remain at home with their biological parent or parents, with support and supervision provided by the local authority. So for the vast majority of children in our data set, we saw that they did in fact go into kinship care at the point at which they left the family home. Another benefit of that longitudinal lens that this data gives us is that we can look across the child's full experience of care, not just see where did they first live, but throughout their whole time spent in care, what types of care environments were they living in. So we saw that for our children in our data set, that around 40% of the children only ever lived in kinship care while they were looked after by the local authority, with a further 23% only living with kinship carers or at home with their parents in that looked after at home situation. So that's around 2/3 of the children in the data set didn't experience any other types of care environment out with the family home and their family wider community, and only about 1/3 who experienced kinship care, foster care or residential care alongside kinship care. As many of you'll be aware, that the act of coming into care can be quite a traumatic thing for a child or young person, and it's certainly an upheaval in their life. So one of the kind of key goals of social work would be to try and ensure that that child then can have stability beyond that point whilst they're looked after. And what we found was that looking across the care journeys of our children, we found that more than half children at the point at which they came into kinship care, that's the living arrangement that they remained in throughout their entire time in care, which was really positive to see. However, for a further 22%, they had one further move of living arrangement, and there were around a quarter of the children who experienced multiple moves of care environment after first living with kinship carers. So some evidence there that we can really improve the kind of stability for young people living in kinship care in Scotland. We're also really interested to know what happens at the point at which children are no longer looked after by the local authority in kinship care. And so this graph is breaking down where children were recorded as living at the point at which they left kinship care. And what we can see here is that around 3 in 10 children are recorded as moving home to their biological parents, which is shown in purple here. And what was really interesting to see was that actually more than half of the children were recorded as continuing to live with friends or family at the point at which they were no longer in the care of the local authority. And that's covered by 2 categories here. So that would be the friends and relatives shown in teal at 50%, and also the category recorded as kinship care order in green. And what a kinship care order is, it's a legal order that gets put in place, and that dictates that that child or young person will remain living with their kinship carer in the long term, and that some parental rights and responsibilities may be transferred at that point. So that while that child is no longer considered to be looked after, if there is a kinship care order in place, that has implications for the fact that there may still be some financial and other supports that are available to the carer and the family. And so what's a wee bit unclear here is out of the 50% that are recorded as friends and relatives, whether or not any of them are actually living on kinship care orders, as clearly these 2 categories aren't mutually exclusive. And we do see that kinship care orders began to be recorded more recently in the data in the last few years. So that's one area where we don't have a lot of clarity within Scotland in terms of how many children are actually living on kinship care orders and how many are living kind of more informally with friends and relatives after the point of leaving care. And it's important just to understand, given those implications for the family in terms of support. We also looked at what happens when children leave care, but across different age ranges. And what we found on the previous slide actually held true across all ages beyond the age of 1. So that the children beyond the age of 1, more than half of them would be likely to remain living with friends and family at the point at which they left care. And the only group for which we saw a distinctly different pattern was for infants under the age of 1. And as you can see in the graph here, around 60% of those infants were expected to return home to their biological parents after leaving kinship care. So some evidence there of some different practice around that younger age group, with them being more likely to return home. So that data set alone was able to give us quite a lot of insight into children's experiences of care while living in kinship care. However, as I said, we were keen to get a more rounded picture and some insights into other aspects of their lives. And so I can share with you some brief results from other data sets that we were able to link to. So from the health visiting data set, which provides information on early childhood development, we had information from both the 27 to 30-month-old visit and the 4 to 5-year-old visit. And what we can see from that, looking at the graph here, where we can see children who have experience of kinship care are recorded in purple, and those in the general population are in green. And we can see that across both of those age ranges, the children who had been in kinship care were around 2 to 3 times more likely to have developmental concerns identified by their health visitor. And drilling into that data a bit more, we were able to see that the most common concerns that they were identified as having were emotional and behavioural difficulties, and also challenges with speech, language and communication. So some really key areas there that we can highlight as areas for support for kinship families. As I mentioned earlier, we were also able to link to education data, and we had quite a wide range of different education outcomes available to us. And what we found from that data was quite a mixed picture in terms of some good news and some not so positive news. So in terms of the good news, what we saw was that across the period that we studied, which, as I say, was largely 2008 to 2019, we found really quite consistent and in cases substantial improvements in terms of educational outcomes for children who had lived in kinship care. And that was across a wide range of areas such as attendance, attainment, exclusion rates, and also what children went on to do after school. As for example, we saw more and more children were staying on at school beyond the initial compulsory 4 years of schooling, on to do a 5th or even a 6th year at the high school. In terms of the not so good news, that what we also saw was that despite these at times substantial improvements, there still remained a gap there in terms of attainment, attendance and variety of other outcomes between children who lived in kinship care and those in the general population. So just to give you a brief example of that, this graph here is showing the exclusion rate for children who've been in kinship care in green, and those who had lived in, had no care experience, or the wider population, in purple. And what we can see here is that the rate for those who'd experienced kinship care starts off extremely high at 311 per 1,000 pupils, but that does rapidly decline over the period of our study to around 119 by 2019. But in comparison to the general population, we can still see that's a highly elevated rate, around 5 times more likely to be excluded than the general school population. We also had a look at what the additional support needs were that were recorded for children. And what we found was that in the most recent data in 2019, that 72% of the children and young people who had lived in kinship care had at least one previously recorded additional support need. Bearing in mind that the kind of level across the population is extremely high within Scotland, so we had around 31% of the general school population that year that were recorded as having an additional support need. But even within that context, that's an extremely high increase that we're seeing there, and an area where we really feel that kind of education support for kinship families is a really crucial area to focus on. So that's some kind of a brief overview of some of our findings. Obviously, with all that data, there was a lot more to be found, but I think some of the key messages that come out of the research for us, I think firstly, just that having access to these administrative data sources is a really positive step forward, and really been able to give us a lot more insight into the children's experience of kinship care, which is a real kind of grey area before that we didn't know as much about, and highlighting some supports that might be required by kinship families. It's important to note that many children do thrive well in kinship care, and it's a really kind of supportive and positive environment for many children. However, a lot of kinship families are supporting children that do have complex needs, and so it's really important that these kind of needs are assessed and that supports can be put in place for families to ensure that children can thrive. I always really like to stress when I'm talking about this research that by no means is this research implying that any of these poor outcomes that we see for the children who have been in kinship care are due to the fact that they have been or are living in kinship care. As with all children in care, many of them will have experienced adverse childhood experiences and trauma prior to becoming looked after by the local authority. And it's well known kind of from research that these things can have long-lasting and profound impacts on children in the long term. So we're expecting it's much more to be a result of that we're seeing in the data. One key thing that we found was the substantial regional variation in children's experiences across Scotland in terms of kinship care. As I highlighted earlier, that was could be in terms of how likely they were to actually live in kinship care, but we also found that it varied quite a lot across local authority levels in terms of how long children would live in kinship care when they were to come into kinship care, and what the legal basis was for them being in kinship care as well. So it's a really variation in practice there that we better understood to ensure that all children are adequately supported. So to say, that was a whistle-stop tour. We have published this research, so that's now available for anyone that's interested to know more. We have a research report available, and we also were fortunate to create an infocomic summary along with some young people with experience of care as well. And both of those can be found at the following link there. But hopefully that gives you a good overview of the research, and yeah, happy to take any questions anyone has. So thank you.
Thank you so much, Joanna. Really fascinating work, and again, probably could listen to you to speak for about half an hour. I'm particularly interested in, I think it's fantastic the work that you're able to do to look at the developmental support and the educational support required within kinship families. I think there's real impact in that work that you're doing. Time for one quick question. I see Gillian put a question in, but didn't. It wasn't really complete. But as she spoke earlier, Neil has raised his hand. I think so. We'll allow Neil to ask a question.
Okay, thank you very much, Joanne. I'm just interested in terms of, are there any plans that you're aware of to get that better understanding of the differences across Scotland?
Not that I'm aware of. I think that's one of the things I think administrative data is really, really good for flagging things like this. And I think to maybe understand it properly, that would be a case of going into local authorities and having conversations with teams and understanding what these differences are. It's definitely something that we're at Celsius we're very interested in. So potentially we'd look to do in the future. But it's, again, with everything, it's a case of funding and priorities. So nothing concrete, but it's definitely very much on our radar and something we'd like to understand better.
Thank you, Joanne. I think you make a really good point in that, yeah, admin data does shine a light on things, but to better understand, we often need to go talk to people and have a sort of qualitative element to our research too. Very quickly, I'm interested, did you look within kinship care at were there any differences between those individuals living with family members or non-biological family members such as friends?
No, I think that would be really interesting to do, and also just to kind of understand what the breakdown of that is. Within the administrative data captured by local authorities and passed to government, it's only recorded as with friends or relatives, and there isn't a further breakdown of that information. It's known from kind of surveys and other sources and the census, when that kind of occurs every 10 years or so, that it's likely to be very heavily skewed towards grandparents. Grandparents are quite a large proportion of kinship carers, and generally maybe around 70% would be kind of a rough estimate. But no, there's nothing within the data that would allow us to kind of break our results down by that or see if outcomes are different kind of between those different groups or anything, unfortunately.
Unfortunately, but I think maybe recommendations to data collectors and social workers to provide a bit more information with that. Or
absolutely.
Great, thanks so much, Joanna. We're going to move straight on to Laura now from Swansea University, who's going to give us a look at what's going on in ADR Wales. Can you share your slides, Laura?
Yes. Let me just get them. Can everybody see?
Yeah, perfect. I'll hand over to you.
Brilliant, thank you. Yeah, so I'm Laura and I work in the Population Data Science Department at Swansea, doing various projects on children's social care. So I'll be talking to you today about a project that I actually conducted a couple of years ago now, about entry routes to care, pathways through care and placement outcomes for the very youngest children in the care system in Wales. So, as many of you may already know, in Wales there are two main routes into the care system. So children can enter care via care proceedings under Section 31 of the Children Act, or they can enter care through voluntary arrangements under Section 76 of the Social Services and Wellbeing Wales Act. There's ongoing questions about the respective merits and ethics of these two routes into care. And some of these concerns were voiced in a report written back in 2021 by the Public Law Working Group. So, for example, regarding voluntary arrangements, critics have questioned whether voluntary accommodation simply buys the local authority more time to assemble an application for care proceedings, rather than serving as a genuine family support service with a clear plan for reunification. And voluntary arrangements are also viewed as lacking any sort of independent oversight of the family courts. So questions have been raised as well about whether parents actually understand exactly what they are agreeing to when voluntary arrangements for care are made. But at the time of the writing of the report and the voicing of all these concerns, there was actually really limited quantitative evidence about the use of voluntary arrangements or compulsory arrangements, compulsory options for infants and for any children. And there's also quite a lack of evidence about the pathways that children take through the care system once they enter care via the different routes, and then their outcomes in terms of their placements. So we set out to address these evidence gaps using administrative data from the population of Wales. And we used anonymised individual level children looked after data and this is collected by local authorities and then maintained by Welsh Government, and it's held in the Secure Anonymised Information Linkage Data Bank, also known as the SAIL Data Bank. And you can read a little bit more about the data set in the ADR Wales Data Explained document here. But for this work, basically we included all infants who were aged less than 1 year who entered care for the first time over an 18-year period between 2003 and 2021, and this was 6,333 infants. And this then allowed us to follow up the majority of these for about 2 years. So there were 5,601 infants who entered care between 2003 and 2019, and then we had a 2-year follow-up window for all of these children. And then the children looked after data, we linked that to the Welsh Index of Multiple Deprivation data set as well to determine the area level deprivation for each infant when they entered care. So coming to the key findings then, the data revealed rising numbers of infants entering care across Wales over the years, although there were significant regional variations, which I'll show on the next slide. But basically the yellow line on this graph plots the incidence rate of infants entering care each year, which is expressed as the number of infants entering care per 10,000 infants in the general population. And you can see that the highest recorded incidence was 141 babies in 2018-19, and the blue bars represent the mid-year population estimates of infants living in Wales. So as you can see, infants have been increasingly likely to enter care over time, despite the fact that infant population estimates have declined since 2012. And although it's not shown here, we also found that newborn babies, so babies who are less than 2 weeks old, also comprise the largest proportion of infants entering care each year and accounted for 38% of infants over the study period. So to show you some of the regional variation then, so this graph plots the incidence rates of infants entering care by local authority, and the yellow line in the middle plots the national average, while anything outside of the blue dotted lines represents considerable divergence from the average. So as you can see, there was quite a lot of variation in the incidence rates of infants entering care for the first time. 7 local authorities had higher than average incidence rates, and 9 had lower than average incidence rates. We also did see a clear relationship between care entry rates and area level deprivation. So the dotted line on this graph shows that in general, rates of infants entering care generally increased in line with increasing deprivation levels. And this highlights sort of the complex interplay really between socioeconomic factors and child welfare interventions. So coming to the findings on the different legal options, we found that over half of the infants entered care under voluntary arrangements, and just over a third entered care under an interim care order, so compulsory arrangements. And we also found that the use of voluntary arrangements has actually been decreasing relative to the use of care orders. But by 2020, this was sort of evening out. So the voluntary arrangements shown in yellow were initially more common, and then particularly since 2014, the care orders, which are shown in blue, started to increase. And this shift in pattern of the use of voluntary and compulsory routes into care reflects the influence of shift in policy and judicial perspectives as well. So, right, oh, sorry, go back one. So we also found that there was significant difference in the care entry routes observed across Wales, which most likely actually reflect different cultures of practice. So in most local authorities, the incidence rate of infants entering care under voluntary arrangements was higher than the incidence rate of infants entering under interim care orders, but the opposite was actually true in North Wales. So it was only in North Wales that there was a lower incidence of the usage of voluntary arrangements. And overall, the local authorities with the highest rates of infants entering care also had the highest rates of use of voluntary arrangements, and incidentally these areas were also amongst the poorest areas in Wales. So we've sort of speculated that it might be that voluntary arrangements were used to manage high volumes of cases, given the fact that the works often involves really short notice periods when infants enter care, either at birth or in the first few weeks of their life. So turning to the infants category of need on entry to care. So this graph here shows that most infants enter due to concerns about abuse or neglect, regardless of their legal status. So regardless of whether they entered through compulsory or voluntary arrangements, most of them entered due to abuse or neglect. And reflecting on the findings described in the previous slide, this suggests that local authorities really are sort of varying in respect of which entry routes to care that they're favouring, rather than the differences reflecting underlying need or risk. We found also that most of the voluntary arrangements actually then became compulsory arrangements within 2 years of the follow-up, and this trend actually occurred more frequently and rapidly over time. So there was 2/3 of those, 2/3 of the children who initially entered via voluntary arrangements actually then ended up going to court and having a care order within 2 years. And again, this proportion was actually higher when we looked at newborn babies separately. And for almost half of the infants and over half of the newborns, these care proceedings were issued within 4 weeks of the initial voluntary arrangement. And again, we were seeing that around 2/3 of the infants who didn't end up going to court, there were concerns there still about abuse and neglect, which suggests that maybe local authorities were trying to manage risk through continued voluntary relationships with parents that never escalated to any sort of compulsory action. But these findings really raise important questions about whether a voluntary agreement with parents is appropriate if, in a lot of cases, the local authority plans to then rapidly issue care proceedings. And it is suggesting that practice in Wales, is responsive to recommendations in high-profile cases, which have cautioned practitioners against delaying court proceedings for infants if there's evidence of harm. And we did find that the route of entry actually did appear to influence the placement outcome. So within 2 years, 60% of the infants who'd entered care between 2003 and 2019 had left. And of those who left, over half who initially came in under voluntary arrangements had either returned home to their parents or returned to kin with a special guardianship order, compared to just over, it was about 1/3 of babies who'd entered care under an interim care order. And then conversely, over half of babies who'd entered under a care order were eventually adopted within the 2 years, compared with 1/3 of those who'd entered under voluntary arrangements. So it does appear that the route of entry to care is influencing the final sort of permanency outcome, with greater family preservation with parents or kin for those who initially entered on a voluntary basis. Placement stability also emerged as a concern in this Welsh study, with 30% of infants experiencing 3 or more placements within 2 years. But those who entered care through voluntary arrangements did actually experience fewer placements than those who entered under a care order. And this kind of really challenges assumptions about the relative stability of the different care entry routes. So when we conducted this study, it was based on the total population of infants entering care over an 18-year period. And we were able to examine both entry to care and then change of legal status beyond initial entry. And by examining these things, we were able to categorise pathways for infants entering care under the two main routes. So 22% of the infants entered care under voluntary arrangements, and they remained subject to these arrangements as a family support service, at least over the 2 years we were able to follow them up. 39% entered under voluntary arrangements, but then became subject to care proceedings, typically within a month. 33% came in under care proceedings and then were placed straight in out of home care, and then there was a small percentage, 6%, who entered care via care proceedings but that were actually placed at home on a care order with their parents. So one of the key messages really here is that local authorities are making greater use of compulsory routes into care rather than seeking voluntary arrangements with parents, but there are really marked differences between local authorities, suggesting that local practices have a considerable impact on the routes through which infants enter care. So again, this is where administrative data has highlighted this variation, and it would be really interesting to do some qualitative work with local authority practitioners and family court judges, and this hopefully might shed light on the reasons behind the variation in the use of these different routes into care. But basically this study is filled in a lot of gaps, evidence gaps, challenged quite a lot of assumptions, and provided quite a clear steer regarding subsequent qualitative reviews of practice to uncover what lies behind the statistics. We've presented this to local authorities in Wales, to Welsh Government, National Community of Practice, and to Mr Justice Keehan as well. And it's been published in a full report that's available on Swansea and Lancaster web pages, a summary report from the Nuffield Family Justice Observatory. Obviously there's the nice summary in the NatSem report. We've also got a forthcoming book chapter on this work and a couple of journal articles which are still in progress. And I'd just like to say thank you to the whole of the Family Justice Data Partnership team, and happy to take any questions now or later.
Thank you so much, Laura. Excellent presentation, and again, a lot of work. I think fascinating how the data can be used to highlight changes in practices, especially when there's change in policy or legal infrastructure, seeing that change in 2014 from voluntary to care orders. We are very tight for time, so I'm going to jump on to the next presentation and then take questions, I suppose, for yourself and Katie at the end, if that's okay.
That's fine.
I see there's some questions in the chat, but we'll come back to them in 15 minutes. We'll jump straight on to Katie, if you want to share your screen. And Katie's going to speak to us about some of her work that she's done with Manchester Metropolitan University, highlighting work going on in ADR England, I suppose. Thanks, Katie.
Thanks, Aideen. Hi everyone, I'm Katie Hunter. I'm at Manchester Metropolitan University and I'm talking today about some findings from an ADR UK fellowship I completed in 2023. I was focused on care experience, ethnicity and the intersections with youth justice involvement in England, and I'm just going to share one sort of extended finding with you today for the sort of sake of time. But it was started at Lancaster University, so I always like to give a shout out to them as well. So a bit of research context then. We know that there is a long-standing overrepresentation of Black and ethnic minority children in the youth justice system in England and Wales. Fairly well established, we've got data going back quite a long time on this. We also know that there's been a long-standing overrepresentation of children with care experience in the youth justice system in England and Wales, but there was previously a real lack of official data on this for us to understand exactly what the nature and extent of this involvement was, and absolutely no official data around the intersections of care experience with ethnicity. We had a Lane review in 2016, which estimated that up to half of all children in youth custody were care experienced, and that 44% of those also came from an ethnic minority background, but that was about it. As a starting point, it's important to say that this is very much not inevitable and that individualised explanations for this overrepresentation don't really cut the mustard. We've got some evidence to suggest that there is unnecessary police involvement in care settings, which can lead to formal youth justice sanctions that wouldn't occur in a quote-unquote family home. We also know that inappropriate responses to vulnerability and victimisation through things like child criminal exploitation, child sexual exploitation, can bring children from the care system into the justice system. And we also have evidence to suggest that when care experienced children do face the justice system, that they're potentially up-tariffed as well. In terms of ethnicity then, there's a lot of research on this suggesting that long-standing disproportionality is the result of intensive policing of Black and minoritised communities. I threw a couple of references in here, but there's lots of work done on this. In terms of that sort of intersection with care experience as well, I did PhD research, which I completed in 2019, which suggested that racially minoritised care experienced children were probably having a double whammy of disadvantage, but we didn't really know what that looked like. But actually, Bernardo's research, which published in 2023, suggested that Black care experienced young people face unfair treatment in both systems of care and justice, and I'll come back to that in a minute. So in terms of this research then, it's an ADR UK fellowship. It used the Data First linked Ministry of Justice and Department for Education data sets, all anonymised data accessed in the ONS Secure Research Service. It was actually partnered with Bernardo's, who were running a complementary qualitative project on Black care experienced young people in the prison system, and that relationship was very much about knowledge exchange and then shared dissemination and engagement activities, and we actually published our research at the same time. The project was also supported by two mentors, Dr. Claire Fitzpatrick at Lancaster and Professor Brian Francis also at Lancaster. So in terms of the data set then, I took a longitudinal birth cohort approach, and I used data from the National Pupil Database with information about schooling and demographics, children looked after returns, about interactions with the children looked after system, and then police national computer data, which could tell me about involvement with the youth justice system. I eventually built a data set that contained information for 2.3 million children born between 1996 and 1999 who were recorded in an educational census at age 10. I took a snapshot approach to using the data because I had so much data that I didn't know what to do with it, and it was sort of the best way to manage it. In this data set, 2.3 million children, I found that 2% had been in care at some point, and I measured that as little as 1 day or up to 18 years, although very few children came in for such a short period of time. And 5%, which is about 110,000, had youth justice involvement. So the resulting findings can give us a picture of youth justice involvement in England between 2006 and 2017. In terms of the findings then, I just want to tell you about measuring the prevalence of youth justice cautions or convictions among the individuals in my data set. So I mentioned that care experienced children accounted for 2% of the overall data set. It's about 50,000 children, but actually they accounted for 15% of those in the data set who had youth justice involvement. So we're already seeing about 7.5 times as many children as we would expect, all things being equal. However, if we look at the 50,000 care experienced children in the data set, I actually found that 1 in 3 received at least one youth justice caution or conviction before the age of 18, and that was compared to 4% of children who had no record of having been in care. So if we break this down by ethnicity then, so this is care experienced children by ethnic group major and the proportion that received at least one youth justice caution or conviction. The dotted line is the average for all care experienced children, which was 33%, 1 in 3. And you can see that there's quite a bit of variation across these groups. So white care experienced children about on average, Black care experienced children slightly below, mixed ethnicity children quite a bit more likely to come into the youth justice system, Asian and other groups less likely to come in. If we break this down further using the 18+ census categorisations, we can see that there's actually quite a lot of variation within these big 5 ethnic groups. So again, the dotted line is the average for all care experienced children at 33%. And I just want to draw your attention to the grey bars on the left, and you can see actually that it's Gypsy, Roma and Irish traveller care experienced children are coming in at like significantly higher rates. So about 1 in 2 children are receiving at least one youth justice caution or conviction before they reach the age of 18. All Asian groups are less likely, although there's some variation. But if you can look at the Black group, you can see that actually the slightly lower rates of youth justice involvement for Black care experienced children seems to be driven by Black African children by being quite a bit less likely, whereas Black Caribbean children are coming in at a rate of about 2 and 5. Similarly, in the mixed ethnicity group, we can see that it is white and black African and white and black Caribbean co-experienced children that are the ones that are being drawn in, more likely to be drawn into the system. So, to summarise then, it's a longitudinal analysis covering 2.3 million children recorded in educational census in England, aged 10. It doesn't include Wales because of restrictions with the data. It is the largest analysis of the topic to date. There are more findings, but I just haven't included them today because I knew that there wasn't a lot of time to do so. The findings do show shocking inequalities in youth justice involvement and also intensifying ones. I've not had the chance to share that, but we can see that existing inequalities in our youth justice system do get worse over the time period that I look at, despite the fact that we have that contracting youth justice system. Now, these inequalities bear down particularly heavily on co-experienced children from some racially minoritized groups, namely Black Caribbean, Gypsy, Roma and Irish traveller children, mixed ethnicity children, are the ones that seem to be being drawn into the system at that higher rate. The most important thing I think to take away from this, though, is that it's really important that we understand the research context behind the administrative data that we're using. So these findings could be used to perpetuate harmful negative stereotypes about both co-experienced children and children from racially minoritized backgrounds, when actually when we look at the other research that's out there, we know that there are a lot of systemic failures actually that are contributing to these patterns in our justice system. So we can't just be data producers, we really have to be data interpreters, and it is our responsibility to be able to do that. So thank you very much.
Thank you so much, Katie, and thanks for keeping the time, because now we're back on track, and you're making me look like a good chair. But fascinating research, and I think one of the numbers that stuck with me there was the 1 in 3 children in care sort of having interaction with juvenile justice system compared to less than 1 in 20 of the general population. So in terms of sort of support that's required, not only for foster carers, kinship carers, advocacy groups that work with children who experience care, this youth justice element is a massive factor in that. Does anybody have any burning questions?